Okay, hi everyone. Welcome to today's webinar on strengthening rural healthcare opportunities from the Texas A&M Health Rural Engagement Program. My name is Cassidy Avila, and I'm the Program Coordinator for Technical Assistance, and I am joined by multiple speakers today, whom I will introduce throughout the presentation as we present to you an overview of the Texas A&M Health Rural Engagement Program. This unique program is comprised of 4 components: rural medicine, rural nursing, technical assistance, and telebehavioral health. And as you can see here on the agenda, we're going to talk about each one of those. You will get a QR code for contacting us on the final slide, but please feel free during this presentation to message me if you wish to engage with any one of the components that you are about to learn about, and I will make sure to get you a direct contact through the chat. The first thing I want to let you know is we are recording, and we will share a copy of the recording as well as the slides with you following the presentation. And next, I just want to say thank you to everyone involved in rural healthcare. Thank you for all that you do, and thank you for being here with us today. We're excited to present the Rural Engagement Program to you and for the opportunity to hopefully support you with some of these initiatives that you're about to learn about. This program is a partnership with the Texas A&M School of Medicine, School of Nursing, and Rural and Community Health Institute, and the Telebehavioral Health Institute. And it is funded by the Texas Legislature. So most of the programs that you will learn about today, represented in the presentation, will be at no cost because of that funding. The program aims to support rural healthcare in communities that you serve, whether through clinics or hospitals, and we achieve this in 2 primary ways. First, through workforce, by fostering interest among Texas A&M medical and nursing students in pursuing careers in rural communities. And second, by offering operational support to improve your performance and financial stability, so you can maintain viability and continue to provide healthcare in your community. Our goal is to broaden access and fortify healthcare delivery for rural Texans. We're comprised of physicians, nurses, and healthcare leaders that have experience in rural healthcare, and we're dedicated to supporting your efforts to provide high-quality care. As mentioned, you can see the 4 institutions here in the Rural Engagement Program: the School of Medicine, School of Nursing, Rural and Community Health Institute, and Telebehavioral Health. Each of these initiatives have different opportunities. In the next few minutes, you're going to hear from representatives from each one and about what they have to offer. Let's see, I think we can. Sorry, guys, I'm operating a couple of different screens here. I think it is time to introduce our first speaker. It is my pleasure to introduce Dr. Carly McCord. Dr. McCord is a clinical research assistant professor in the Department of Psychology and director of the Telebehavioral Health Institute at the College of Medicine. Dr. McCord, if you want to unmute, I will hand it over to you.
Excellent. Howdy, everyone. Yes, I'm Carly McCord. I'm the executive director of the Telehealth Institute, and it is a privilege and a pleasure to be with you all today. I have had the privilege and pleasure of serving rural and underserved communities for my entire career. So we first started doing telehealth back in 2009, offering telehealth counseling to one of our rural communities outside of A&M. And we have grown and grown and grown all the way into an institute. We still have the same heartbeat in behavioral health. We do a lot of telehealth counseling, touching almost 30 counties now in Texas, in schools, in primary care clinics, in hospital settings, in jails, and in community settings as well. So you name it, I'll design it with your help. It's kind of been our model. It drives some people crazy that everything looks unique. And I just think that that's because each of our partners brings a different need and different strengths and different capacity. And so then we create something together. So we'll continue to drive forward in our behavioral health expansions, particularly through counseling, always recruiting psychiatrists in partnership with our Department of Psychiatry. as you all know, those are harder to come by. And the Institute, we are in our first year, but you will continue to see over time us driving forward in other telespecialties. The first one that we are creating at this time is neuropsychological assessment, particularly for dementia evaluations. So that's something new for the upcoming year through this funding, that there would be partnership opportunities available there. And then I want to hear from you guys. I've got my clinical director who's got extensive experience in rural and underserved hospitals and clinic settings coming on board in a couple weeks. So we would love to have your input on what needs you have, where you would like to see us focus and grow over the coming years. Let's see. We also are the super hub for ECHO. So if you've not heard of Project ECHO before, it's a model of demonopolizing knowledge and helping train and equip in a lot of different arenas. So we often want to have the same set of providers or people who are wanting to learn more about a particular area of interest to meet weekly to do a case presentation discussion with a subject matter expert, and then get some didactics or learning components where you get continuing education credits as well. So the first one to launch in the near future is going to be our TREAD ECHO, which is Texas Rural Education ECHO. So we're going to be partnering with schools, particularly school counselors first, but then on to coaches and principals and other school personnel to better equip with tools and skills to work with mental health needs. Obviously not treatment, but there's a lot that we can pass on in terms of what we know as providers onto these other personnel, so they feel better equipped to handle those. So if that's not you and you're not in schools, that's okay. I would ask for the same input as I'm asking for the specialty care. We're here to serve you, and Texas wants us to serve you. So if there are particular needs, whether that's psychiatric medication management, or whatever you can think of that you say, man, I sure wish I had somebody, a subject matter expert that would pour into my providers in a particular way and increase their skill set in this area. We'd love to have your input on that. And then we're steady working in the background on different distinctions and specialties here at A&M, so that hopefully we are equipping the workforce of the future to be ready for rural and ready for telehealth. So that's just sharing good news. But if you guys have any questions or comments, feel free to reach out to me. Thank you for your time.
Thank you, Dr. McCord. Okay, so next up, I would like to introduce Carol Brewer is speaking next. Carol Brewer is representing the School of Medicine today, and she is the Assistant Director for Rural School District Relations in the School of Medicine. Carol, it's all yours.
Thank you so much for having me. We're glad to be here. The Rural Medicine program in the College of Medicine addresses the shortage of healthcare professionals in underserved areas. What we work with hospitals and healthcare facilities in rural communities in an effort to rotate our medical students through those hospitals and clinics. And when we do that, we connect a group of leaders in the community so that our medical students are experiencing a community immersion. They are connected with the community. They often go to dinner. They may have lunch with the Rotary. So they really understand what it is to be a part of that community and to be a leader in that community, and what it would mean to practice medicine in that community. And that footprint has served us well. In one of our counties, in Mason County, we've had a med student that has signed a contract to finish his residency and come back and be the medical provider in Mason County. So that is something that's working for us, and we're glad to see that growing to more communities. We're currently in 27 counties. We have a goal of 50 counties by the end of 2026. So we are in fast-paced growth for that. One of the other opportunities that we offer is while we are rotating our medical students through those clinics and hospitals in rural Texas, we want to also come in and support the school districts who are raising the next medical provider in rural Texas. And so we have a program that offers support and healthcare career enrichment programs within the school districts in those rural communities where we have affiliations with the hospitals and clinics. In addition, we have a community APGAR projects where we offer services to critical access hospitals to help them identify and prioritize their recruiting and retaining of family medicine physicians. Can we go to the, I think we have, the last thing would be that we have a rural practitioners conference. So save the date, March 28th and 29th. This conference is specifically for practitioners and physicians that are practicing in rural Texas. So come and learn and gain some information and practice, connect with your other practitioners in rural Texas. So we look forward to seeing you March the 28th and 29th in Fredericksburg, Texas.
Excellent. Thanks, Carol. And it is now my pleasure to introduce to you Dr. Kim Hudson Gallagly. She's the Clinical Associate Professor and Director of Nursing for the Rural Engagement Program.
Thank you. It's my pleasure to talk a little bit about what nursing is doing with rural health engagement. One thing, we're giving away some money, which is always nice. We provided about 19 scholarships to students that range from the RN to BSN program, the master's program, and the DNP program, both in family, as a family nurse practitioner, psych mental health, and forensic nursing, as well as the RN to BSN program. So we're very happy about that, being able to provide those scholarships. We still have a little money left over, so we hope for this year. So we hope to give some more money away in the new year. This money is allocated by the state of Texas, and it's $350,000 every single year. So and it is permanent. What I understand is permanent scholarship money. So we'll hopefully be able to use that every single year for our students seeking advanced education. We accept those applications in the spring. We're looking at changing our application timeline just a little bit to ensure that all students have that access to the applications, because we've added a couple of tracks to our nursing program, and we just want to be sure all students have that availability to apply for those scholarships. The scholarships can range anywhere from $10,000 to $20,000 to $30,000. So it is a significant amount of money that will help our students get through to advance their education, to upskill their education. You can go to the next slide. One of the things that our undergraduate program has been working on for a couple of years is developing a curriculum and clinical experiences that are rural focused. We have just completed that curriculum development. It's kind of in the final processes of approval, just tweaking it to ensure that all students have access to rural focused curriculum as well as rural opportunities in the counties surrounding all of our hubs, which is Round Rock, of course, College Station, and then we'll soon be in McAllen in 2026. So we hope to all be able to provide those resources to all of our students. We did have a community health pilot project this summer where we had 10 students who did much like what the medical students do. They are immersed into a rural community, and they are working with preceptors in those rural communities in order to get that exposure and experience in working in a rural area. So we hope that we can continue that, and we're looking forward to expanding that moving forward. We do create clinical practice opportunities in our rural health clinic, which includes some of the telehealth opportunities. We have just learned that we have a rural fellowship approved, or a residency, if you will, approved. And we have 2 faculty members, Dr. Kroll and Dr. Sorensen, that are working on getting that rural fellowship in place. where we will support that fellowship, that residency for a nurse practitioner in a rural agency. We have, we're almost there as far as achieving a rural health center designation at our Navasota Rural Health Clinic and our mobile unit. They are eligible for that site visit as of August the 1st. So they can drop in at any point in time to start that audit for the designation. And once that designation is, once the audit is completed, we are available for that designation, and it should be official within 3 months, but it is retroactive. We also look to increase our access through telehealth at rural school districts. We have nurses and nurse practitioners that are providing or who are partnering with school nurses and community primary care to deliver services. We are in the process of looking for a psych mental health echo program manager. We had one applicant last week, and we're hoping we have more. The position has been posted for a little while because that psych mental health is a specialty certificate, and we want to make sure that we have the right person going into that position. We're there to work with our provide nurse practitioners to deliver primary and mental health care in those areas, rural designations. Part of what I hope to do over the next months is have the opportunity to meet some of you in your clinical agencies and discuss what exactly you need. I have talked with several nursing facilities and agencies, and they've talked about in some areas, such as a mobile health clinic, those kind of things, they would like to have a nurse practitioner or nurses working there. They feel like one nurse practitioner can help some of their clinics. So that's part of what we're trying to do with our programs at Texas A&M. That's it.
Excellent, thank you. Now it is my pleasure to introduce Melissa Lackey. She is the Director of Technical Assistance for the Rural Engagement Program in the Rural and Community Health Institute. Melissa?
Thanks, Cassidy, and welcome everybody. Thanks for spending your lunch hour with us. As Cassidy discussed earlier, the program is a collaboration between medicine, nursing, and the Rural and Community Health Institute, because we acknowledge that strong hospitals not only need strong operations, they need to be financially viable, but they have to have a strong and supported workforce. So we provide technical assistance. That's the primary work that I do. I have a great team. We have a team of regional liaisons that cover the state of Texas. Those teams consist of a workforce coordinator and a technical assistance coordinator. They go on site to the hospitals to help identify challenges that the hospitals or clinics are having, and then develop these technical assistance plans. Our primary components of assistance that we provide in the areas that we work in include financial and operational performance improvement support. And that looks like a variety of things. Maybe a hospital has not had a charge master update and needs to get some competitive pricing in place. So we can support that type of service. We can help with denials. If you have a high rate of denials, we provide cost report reviews. So anything that's directed towards the financial or operational performance of a hospital or clinic, we can discuss with the hospital or clinic and formulate a plan of support for. We provide value-based care transition support. We know that is the direction that we are moving in. We know it is confusing. There are a lot of contractual considerations. There are a lot of opportunities for maximizing those benefits, and we have a great team to lead you through that transition. And we'll have some additional information about that after these technical assistance slides. Workforce development. We work closely with College of Medicine and College of Nursing. Their primary work is the Rural In, Rural Out program, getting those students immersed in rural communities and having them return to those communities after they have these great workforce experiences. But there's also more to that. We work on development and education opportunities for current workforce. We provide certification support. We have several hospitals that we are supporting the NRHA CEO, CFO, or CNO certification course, which is pretty expensive. As you know, if you've looked into any of those certification classes, we've provided wound care training for hospitals that are trying to develop wound care programs or strengthen their swing bed programs. We have provided infection control education. So just a host of things that we can provide around that workforce development piece. We provide service line development opportunities. That's primarily been through swing bed development because we know that swing beds are a vital source of revenue for rural hospitals and rural communities, but we are expanding that to include outpatient geriatric psychiatric services and potentially cardiopulmonary rehab services. We have marketing and community engagement opportunities. We currently are hosting a Medicare Advantage education campaign, educating our communities, our rural communities, on the impact of Medicare plan choice, whether they go with an Advantage plan or they go with traditional Medicare, understanding how that reimbursement impacts their access to local health care, and what that looks like for their hospital and keeping that care local. We have monthly educational webinars on a variety of topics. We have done leadership. We have done financially focused educational webinars. We have done project focused webinars around denials. We provide education on coding and billing updates. So if you have an interest or a topic that your hospital or clinic would like to hear more about or have us provide education, if you reach out to us, we can work with you to potentially develop a webinar series around that. I will say all of our services, because of our legislative funding, are provided to you at no cost, which rural hospitals run on a very thin margin and often don't have the additional funds for those types of workforce development or service line development focus. So we would love to hear from you to talk more about our services. Our regional teams would welcome the opportunity to visit on site. I think our program has touched 68 counties across Texas now, combined with our efforts between medicine, nursing, and the technical assistance piece. So next slide. And if anyone has questions, feel free to raise your hand or unmute. I'm happy to answer those. There is a process for requesting technical assistance. We have a TA inquiry form you can submit, and then one of our coordinators will reach out to you to schedule a time for a call. We'll have the call. We'll identify your priorities, and that's based on your need. You tell us. We formulate these support plans based on your specific situation. Our team comes on site to assist with planning. We engage our rural health experts. We use a wide variety of consultants, from financial consultants, leadership consultants, workforce consultants. We gather some assessment and data collection, and then we develop the plan and we implement the project for support. We provide ongoing plan review, and we do some sustainability and some evaluation planning with you to make sure that the things we have supported you in, that make sure that those efforts are sustainable for you, and to also ask what's next. How else can we support you? So I would encourage you to take a look at that form. It's really short, and then one of our coordinators will reach out to you. These are some of the projects that we've implemented over this past year. I discussed briefly our Medicare Advantage Community Education Project. That's a group of 30 hospitals that are receiving targeted messaging and marketing support and getting information out to their community. They have opportunities for one-on-one consultations. It is going really well. We are in our third round of messaging for those hospitals. So if that is something of interest to you, please feel free to reach out to us. We have a Just Culture project in progress. We have a group of 10 rural hospitals participating in this project. This is focused on not only workforce retention and job satisfaction, but patient safety. We provide swing bed education, and that is a very intensive 6 to 9 month program where you get routine consultative support for development and support of your swing bed program. We have provided, this is called Ignite the Patient Experience. It's an actual on-site retreat to help boost your CMS ratings. And it focuses on patient engagement, it focuses on staff satisfaction, and it focuses on bolstering those HCAHPS responses and scores. I mentioned some of the financial improvement opportunities that we have been able to implement. We provide predictive financial modeling. If you just want to know what it's all about and you want to talk with one of our coordinators about what would it look like if we are thinking about adding a provider, what would that look like over the course of 3 years? We have some predictive financial modeling we can provide you with, all at no commitment and no cost to you. And then I discussed the workforce training certification. So lots and lots of opportunities out there for our rural partners. These are the counties we've touched. Here's a listing of our workforce coordinators. We've got a West, East, and South region. So we would love to hear from you. I think our next couple of slides speak to our value-based care work. So I will hand it back to Cassidy to introduce our value-based care director. Thank you all.
Yeah, thank you, Melissa. Speaking now is Rayanne Davis, who is the Director of Value-Based Care at Texas A&M Health Rural Engagement Program. Rayanne, it is all yours.
Thank you, Cassidy. Further aligning with the goal to improve high quality of care, as part of the Rural Engagement Program, we provide value-based care technical assistance with the focus on these 4 pillars of engagement. The engagement helps optimize and enhance value-based care in these contractual incentives across various payers. And like Melissa said, sometimes they're very complex. There's a lot of regulatory literature that goes along with them. So really doing some deep dive in what it means in strategy in value-based care and alternative payment models. The consultant engagement is tailored to the organization's need. We can assist in reviewing value-based care strategy, design, implementation, and review incentive contracts. Additionally, we can offer valuable guidance in assessing new opportunities for growth in value-based care and exploring new payment models. For instance, this past year, we supported clinics in evaluating the opportunities and key factors to consider when deciding to join an accountable care organization. We are also developing programs to support providers in quality performance and care gap closure, and enhancing accurate diagnosis codes to improve risk score capture, which is a key component of alternative payment models and being successful. If you don't know what risk score capture is and you're just starting in your value-based care journey, we can help provide some education around that for your team and your clinicians. Another example, throughout this work, this past year, we've engaged with clinics providing guidance as they develop their chronic care management and remote patient monitoring programs. We help them optimize their current chronic care management programs, or if they're looking to explore and adopt these new services, providing some key characteristics when they're considering developing these service lines. Throughout all this, we recognize these activities are very important to the success in value-based care, and they provide opportunities for additional financial incentives. I look forward to working with additional rural hospitals and clinics. If you're interested, please let us know through the technical assistance inquiry forms.
Thank you, Rayanne. Okay, we have reached the Q&A portion of the presentation. So I'm looking at chat and I see Melissa has fielded a lot of questions. So thank you, Melissa. We are recording the presentation. Give us a little bit of time to get it posted, and we will share the recording as well as a copy of the slides with you. We'll send that out in an email to everyone that registered. And you have a couple of, Melissa has been kind enough to share a couple of follow-up things on the various programs. We've also dropped in the link to the technical assistance inquiry form if you are interested in reaching out for value-based care or technical assistance support. You can use that to do so. The QR code on your screen right now will take you to the Rural Engagement Program landing page, and there you will find information and links to all of the various components of the programs, all 4. So that's a great resource to kind of give you a high-level overview and then put you in touch with anyone that you heard from today. I don't see other questions in the chat though. We have plenty of time. We won't stay on unless you guys have questions for the last 30 minutes, but we have plenty of time to answer any questions. If you would like to unmute or drop something into the chat, we'll give it a couple of minutes. I'll double check just to make sure we didn't miss anything. I don't think so. while we're waiting for potential questions and before we adjourn, are there any speakers that have any final thoughts or any additional comments that you would like to make? I want to thank you for your time. It was an excellent presentation by all of the program components, and we appreciate you taking the time to be here with us today and give us more information on your program and the initiatives that you have going on right now. And especially thank you to everyone that joined the call. We know you're busy and you had other things you could be doing, so we appreciate you being here with us today. If you have follow-up questions, please don't hesitate to reach out to any of us. We would be more than happy to spend some time talking to you and telling you about what we could do to hopefully support you. Okay, well, then we hope to hear from you, and we have nothing else. I guess we will go ahead and wrap it up. Thanks, everyone. Bye.